Dr. Barnes here. Somebody asked me a real good question. They said, what's the safest medication for ADHD? So somebody comes in, they have all the symptoms of ADHD. I show them all the options, stimulants versus non-stimulants, and they ask this question. So I start going through my head, and I think to myself, well, how do I define safety? As a doctor, the way I define safety is, what happens if you take too much of it? What happens if you get a side effect? What's the worst side effect that can happen? So in my head, I'm like, well, stimulants clearly work better, but are they safer? I had a hard time telling them that. So stimulants clearly work better. They're the first line treatment, have the most efficacy and success. But when you compare it to the safety profile of other medications, probably not better. So you go to the non-stimulants, and now I start analyzing non-stimulants. In there is Strattera. It's my opinion that this is probably the safest one. You think of guanfacine and other ones that could lower blood pressure, and of course Strattera is not 100% safe, and in some people could be unsafe. But in response to this question, this is a clear-cut answer that Strattera atomoxetine is probably the safest. Hit me up in the comments.